As the dean of a medical college, I can assure you, all doctors go to medical school because they want to make a difference and serve their patients. Many times when clinicians, especially early stage clinicians, trainees, and they want to make sure that they have the most up-to-date guidelines to ensure that their patients get the best possible care. The trouble is that a lot of the guidelines that we currently have are based on evidence and data from high-income countries. The other thing is that you want to have just-in-time information where the clinician gets the most up-to-date information and evidence-based guideline so that they could provide the best possible care to their patient. And so we thought that if we could create some mechanism by which every person in Pakistan and in the region could receive the kind of quality of care and the evidence-based treatments that they receive at Aachen, wouldn't that be amazing?
So I think treatment decisions are generally can be complex because it's not just my own knowledge. It's also my experience. It is also the context of the patient, where we're seeing the patient, what is the social and economic background of the patient. A lot of physicians who are actually very good physicians who care for their patients may sometimes find that that is a barrier to care. And this book sort of breaks that barrier because it's putting all of these guidelines together for them in a very Pakistani context. So we understand the context and the challenges of healthcare that are here. So we've tried to adapt those guidelines from Europe, from the UK, from the US, and put them in our setting.
It's a very lonely feeling when you are with a patient, you're in the middle of a case, you're taking care of a patient who might be severely injured, and you feel that it's only you between a certain death and maybe a better outcome for a patient. And one of the messages we're trying to convey is that you're not alone and that we are with you. And so we hope that with this manual, people who are in resource-limited situations will be able to refer to it, where they can look at this and say, what do I do next?
So this manual has the potential to be a game changer. It can change the way our doctors and our junior doctors treat patients. Quite possible that the kind of quality that we offer in AKU can be shared across Pakistan in all the other hospitals if people follow the guidelines that we have created. And this is just the first step. This is the first edition of the manual, and we are here to stay. We are inshallah going to build many more subsequent editions of this with input from other colleagues across Pakistan to make this even better. So this is just the first big step to something much bigger.
The AKU Manual of Clinical Practice Guidelines is available in 3 places. Of course, available at any bookstore where you can get the physical book. 2, it's available as a mobile application and you can download that the way you download applications. And 3, it's available on the AKU website at www.guidelines.aku.edu, where you can get the free version of the mobile application.